Hi, and welcome to OS2U's Training and Development Center's presentation, Practicum Training Programs. Today we will be discussing who we are, our Practicum programs, who they are ideal for, how they help coders, our training approach, the prerequisites, cost of tuition and supplies, payment options, and ways to contact us. OS2U Training and Development Center was founded in 2015. Our goal is to coach coding professionals so they are compliant in coding practices. OS2U's affordable, comprehensive medical coding training program is designed for certified and non-certified medical coders alike. The disciplines covered in our practicums are HCC, HRA, CCC, and an AAPC-approved course known as Practicode. HCC is OS2U's Risk Adjustment Practicum training. It is a 10-week online course designed to prepare certified coders for payors who use hierarchical condition categories, or HCC, to report risk scores to CMS. It is also commonly known as our pre-season training. Coders proficient in risk adjustment have proven abilities and experience to read medical charts and assign the correct diagnosis codes for a wide variety of clinical cases and services for risk adjustment models. Students meet with our instructors twice per week to discuss the principles of the most common and complex HCCs that they'll encounter during risk adjustment peak seasons. They'll utilize redacted charts and modified payor rules to prepare coders for the upcoming retrospective risk adjustment season. The course is packed with amazing tools to expand your knowledge base in CMS rules as it pertains to risk adjustment. HRA is also one of OS2U's risk adjustment practicum trainings. It is a 10-week online course designed to prepare certified coders for the concurrent risk adjustment coding reviewing home risk assessment. Coders proficient in coding home risk assessments have proven abilities and experience to read medical charts and assign the correct diagnosis codes for a wide variety of clinical cases and services for risk adjustment models. Students will meet with our instructors twice weekly to learn and practice the skill set needed to perform. This practicum also helps students learn how to identify all chronic conditions and acute and historical conditions from patient charts used to predict patient outcome, case management, and HEDIS measurements. Coders will be able to use the provider's assessment to identify root causes of health issues through coding charts. OS2U's Complete Code Capture Practicum training is a 10-week online course designed to prepare certified coders in retrospective risk adjustment season for payors who use the Complete Code Capture method to report risk scores to CMS. OS2U's Complete Code Capture Practicum training is a 10-week online course designed to prepare certified coders in retrospective risk adjustment season for payors who use the Complete Code Capture method to report risk scores to CMS. It is also commonly known as our pre-season training. As presented in the HCC model structure, ICD-10 CM diagnosis codes need thorough clinical documentation and complete and accurate diagnosis coding. Coders proficient in Complete Code Capture have proven abilities and experience to read medical charts and assign the correct diagnosis codes for a wide variety of clinical cases and services for risk adjustment models. Students will meet with our instructors twice weekly to learn and practice the skill set needed to perform compliant coding utilizing the entire ICD-10 CM code set. Practicode is an online rapid experience generation tool created by AAPC. This teaches and tests medical coding proficiency using real, redacted medical records concentrated on the top hiring medical specialties. Quickly learn and apply new coding skills and gain experience that you can apply to a new job or advance your career. Practicode helps coders with every level of experience in the outpatient setting, from a new professional to a tenured veteran. Get real-world experience coding a variety of medical records or try our specialty modules. Practicum courses are ideal for both unemployed and underemployed coders with less than 2 years experience, veterans and GI Bill recipients, and those interested in healthcare and making a difference behind the scenes. Objectives for Practicum training are various and consist of the following: understanding the different risk adjustment models and common risk adjustment conditions, introduction and review to CMS and industry standard coding resources, how to identify clinical documentation elements with chart analysis tips, encoder navigation and common EMR formats, workspace organization to improve efficiency, production, and quality, as well as how to create a risk adjustment-centric resume. Prerequisites for these Prerequisites for our Practicum courses are as follows. Students must attend or listen to an OSTU online info session, be a certified coder through AAPC or AHIMA, and complete the OSTU coding assessment. Pricing for tuition for each practicum is $500 and is due to OSTU 2 weeks prior to class start date. Supplies for each respective course is typically the 2019 and 2020 coding manuals. Their pricing can be found at AAPC's website. Bundle up and save when you combine our select boot camps with practicum training. OSTU also offers medical coding boot camps which boast a 94% first attempt pass rate and earn students 16 CEUs. While OSTU boot camps are not a full coding course, they serve as valuable prep courses to prepare students to sit for their AAPC exam. We focus on test-taking tips and learning how to tab resources appropriately to improve time management when finding the answers needed for testing. Our coding boot camps are outlined as follows. Bootcamp 1 is for CRC, where a certified risk adjustment coder has proven they know how to read a medical chart and assign the correct diagnosis codes. Bootcamp 2 is for CPC. The certified professional coder credential validates your knowledge of CPT, ICD-10, and HCPCS Level 2 coding skills in a physician setting. Bootcamp 3 is for COC. The Certified Outpatient Coder, formerly CPCH, provides the principles of facility coding for the hospital and ambulatory surgery center settings. And finally, Bootcamp 4, CIC. The Certified Inpatient Coder is the only credential dedicated exclusively to inpatient hospital and facility coding offered by AAPC. Here is an outline of our coding bootcamp program details. Student enrollment is limited to 30 students per session. You must have completed a coding course or have attempted a certification exam, obtained the most recent certification study guide from AAPC as well as coding manual, and obtained a certification exam voucher from AAPC. Save big when you bundle our practicums with a boot camp to better prepare you for sitting for an AAPC exam or to enhance your marketability in your coding career. We are proud to offer multiple programs and affordable options to those looking to invest in our courses. From VOC Rehab and scholarships to GI Bill, MyCAA, and most recently WIOA, we have many ways to complement our pricing with affordable and competitive rates for those choosing self-pay. We also offer many different scholarships and discounts, including 10% off for certified nurses, military spouses and veterans, students who pay and register 30 days prior to start date, as well as scholarships for up to 10 students who receive magna cum laude on their AAPC certification. OSTU discounts offered will only be applied to one course tuition, and only one discount can be applied per course. So are you ready to enroll? Feel free to reach out to us and our team will be happy to assist you.